Hello friends, I am Dr.Pritesh Junagade, Haematologist and Oncologist practicing in Nashik and Mumbai for last 4 years. I have been trained in UK in Haematology and Oncology for 7 years and returned back to India in 2008. Today I am going to tell you about blood cancers. A general overview about blood cancers, a very frightening term. The moment you hear about blood cancers, you just feel something different. Any of your relatives, friends, families having diagnosed with blood cancer, you would know the shock you are in when you hear this word. But I just want to tell you today that blood cancer is not the same disease what it was say 25-30 years ago. We have moved on, the scientific community has moved on, so much research into new medicines is taking place, newer vaccines are being available, that I am sure that we will be able to tackle most of the blood cancers today or tomorrow. So what are blood cancers? Why does blood cancer happen? Let's see. A blood cancer is nothing but a cancerous growth of the cells which are normally present in your blood. The three cells which are red cells, white cells and platelets, blood cancer is caused by problems or surge in your white blood cells. When your white blood cells rise, they go beyond a certain point, it is termed as a cancer. And if it's a blood cell, as I told you, it's called a blood cancer. Blood cancer is a very broad term. There are many types of blood cancers which are there in our community, in our population. The two most common is acute leukemia, which is also called blood cancer, or chronic leukemia, chronic meaning it is we have had it over a period of months or in some patients years. So acute leukemia and chronic leukemia are two subtypes of blood cancers or leukemia. In acute leukemias, the cancerous growth is very rapid and this is a very serious disorder. Most of the patients who come with acute leukemia present in 15 to 20 days with easy bruising or bleeding, weakness or low hemoglobin and repeated infections because the normal white cells which should be present in the body are not there. So in acute leukemia, you present to your doctor, they might refer you to a hematologist or an oncologist. After that, we do certain tests to diagnose this leukemia, and a common test is called a bone marrow test, where we go into the factory where these cells are formed and diagnose it. We do have many special tests to see what subtype of acute leukemia you have, and according to that we start immediate treatment. Patients with acute leukemia need immediate treatment, and the only treatment form which is important is chemotherapy. Chemotherapy is nothing but giving some chemotherapy or chemicals which target or kills the cancer cells through your veins. In some patients we do get some capsules or tablets as well. This chemotherapy is varying. In some kind of leukemia, you give chemotherapy for 7 days. The patient has to stay in the hospital for up to 4 to 5 weeks even. We can repeat many cycles, especially 4 cycles in acute myeloid leukemia. If you have got acute lymphoblastic leukemia, which is another subtype of acute leukemia, sometimes treatment can be given on an outpatient basis after having admitted the patient for a month at the start of treatment. Depending on what type of leukemia you have, there are certain genetic factors, certain acquired factors which are responsible for causing leukemia. People ask me, patients ask me, why me? I don't smoke, I don't drink, why do I get leukemia? I'm a good person, I pray to God every day, why I've got leukemia? I tell them that leukemia is not one disease. Some patients who get leukemia are prone for cancers because of certain genes which are defective in their body, and these they have got from birth. It's not in our hand what genes we get at birth, but those faulty genes are not only important. There are other certain parameters which play a role, and those are called acquired factors. If people or patients who get leukemia sometimes are exposed to certain chemicals or dyes like benzene, they might have had radiation injury in the past. There are certain drugs like chemotherapy drugs taken before which can cause leukemia later on. So leukemia can be caused by few agents, but in 60 to 70% of patients we don't find a cause of leukemia. Let's talk something about chronic leukemias, which I told you earlier. Chronic leukemia is a slow disease. That's why it is called chronic. People get two main kinds of chronic leukemia. One is chronic myeloid leukemia, which is a completely treatable disease today by a simple tablet. This is a great revolution in our medical field in the last 10 years. Then there is something called as chronic lymphocytic leukemia, where the lymphocyte, which is a type of white blood cells, they are up. Again, in many patients with chronic lymphocytic leukemia, they do not need any specific treatment in many cases. Well, if they progress or if they become rampant, we need to control the cells and then we give chemotherapy. Generally, radiotherapy or radiation therapy has no role in leukemias. Chemotherapy with leukemia is very intensive and more aggressive. In spite of treatment, some of these patients do relapse, meaning the leukemia can come back again. In my future talk, I will tell you in detail about each subtype of leukemia. If you need any further information, please do not hesitate to visit our website, which is there on your screen now. Thank you.